Majority of emergency surgery cases in Uganda are trauma-related, with head injuries and limb fractures topping the list, majorly due to road crashes. Health experts also explain that obstetric emergencies add more complexity to the situation. All the mentioned are life-threatening situations, and health workers have to take quick decisions to save a life. However, they are finding difficulties in obtaining informed consent, especially for emergency care. This is according to research findings by Dr. Olivia Kituuka.
Information that is given during consent for emergency surgery is actually not adequate. And it's not adequate because, first of all, the patients at times are in a position where they are unwell and they don't have a great capacity. They have an impaired capacity to consent. They are unconscious or they are in pain. We also found that for many of the patients, the information that was being given to them was in a language they couldn't understand, and they many times just agreed to having surgery without really knowing, understanding fully what information was given to them.
If you're wondering why this is important, Dr. Kituuka explains.
In my work as a surgeon, I have been involved in providing emergency care in both public and private institutions. And many times what has happened is that, especially in the private institutions, it's now also creeping into the public institutions. After offering surgical care, emergency care, we've got challenges where we've had litigation arising from what we did. And many of the things that most of the litigation centers around the patients or their next of kin not having had adequate information and therefore becoming dissatisfied with the outcome of whatever was done.
Whereas there are existing guidelines, for example by the Uganda Medical and Dental Practitioners Council and the Patients Charter, Dr. Kituuka says they are not sufficient.
It's still a little bit grey on how to go about it in an emergency setting, especially like for emergency surgery, where the patient is sometimes unable to consent, or the people has no surrogate decision makers available for them to provide the consent.
We have what is called implied consent. That is, you would like to perform a life-saving care in a patient who is unable to give consent. But this must be adequately documented. But as soon as the patient is able to, further treatment should be done with the consent of the patient.
For some of the attending colleagues, the adjustments in the guidelines will protect the health profession and the workers.
It so happens that we're in a helping profession and we have a goodwill to help, but people are taking us to court when they see that there are some gaps.
Informed consent is the process of constant dialogue between the health worker whose purpose seeks respect of a patient undergoing treatment. Walter Mwesije, NTV.